Hello, I'm Dr. Gayana Amiyangoda, a lecturer in pharmacology at the Faculty of Medicine, Peradeniya, and a consultant endocrinologist with special interest in lipid management. So, a lot of people these days are concerned about high cholesterol level and question whether they need to do something regarding their high cholesterol level. So, in this video, I'm going to talk about your cholesterol level. What is the importance of high cholesterol level? Do you really need to worry about it? Well, let's find out. About 1 in 3 people globally die due to cardiovascular diseases such as heart attacks or stroke, which we know as paralysis. About 40 to 70% of these people are also having elevated cholesterol levels. So this highlights that having high cholesterol levels not only increase the risk of death, but also increase these long-term debilitating cardiovascular conditions. How does this happen? Cholesterol is required in normal amounts for physiological functions in our body. But when the level of cholesterol goes up, it becomes very sticky and deposits in the walls of the blood vessels, making atherosclerotic plaques. These deposits can block the blood flow of the blood vessels and can rupture and eventually completely block the blood flow to the organs. So, if a blood vessel supplying heart is blocked this way, it is called a heart attack. And if a blood vessel supplying the brain is blocked this way, it is called stroke or paralysis. How do you get cholesterol in the body? Some amount of cholesterol is already produced in the body, in the liver, and some cholesterol we get from the food that we eat. How can your cholesterol go up significantly? In normal people with aging, there is rise of blood cholesterol level. And unhealthy food like fatty food and starchy food, overweight, obesity, physical inactivity, alcohol, and genetic conditions which increase cholesterol level, and also certain medical conditions like thyroid diseases and kidney diseases, and certain medications, they all can increase your blood cholesterol level. So, what are the symptoms you develop when you have high cholesterol level, or what will you feel when you have high cholesterol level? Most of the time, when your cholesterol goes up, you will have no symptoms. Unfortunately, the symptoms appear when you develop a complication due to high cholesterol level or atherosclerotic plaque. So this is the reason that we recommend to check your cholesterol level early and take necessary actions to reduce the cholesterol level before it goes on to develop a complication like cardiovascular disease. Okay, now we learned about the importance of high cholesterol level. Let's understand the results of your cholesterol report or the lipid profile. When you look at a lipid profile, you will see various results under various terminology. There will be total cholesterol, LDL cholesterol, HDL cholesterol, VLDL cholesterol, triglycerides, and various ratios. What are these? Cholesterol and triglyceride are not soluble in water. So, these need some kind of a transporter or a molecule for them to be carried throughout the body. We call these transporters as lipoproteins, and examples of lipoproteins are low-density lipoprotein, high-density lipoprotein, VLDL or very low-density lipoprotein are some of the examples. So when cholesterol binds with LDL particle or cholesterol gets into this LDL vehicle, it becomes LDL cholesterol, and this LDL particle is known to transport cholesterol from the liver and to the rest of the body, and also is known to deposit cholesterol in the blood vessels as atherosclerotic plaques. So hence it is termed as bad cholesterol. Similarly, when cholesterol binds with HDL, it is known as HDL cholesterol, and this HDL molecule is known to transport cholesterol from atherosclerotic plaques or the peripheries back to the liver. So it is known as good cholesterol. Okay, so when you have a look at your lipid profile, how do you know if you have optimal cholesterol levels? So in a normal person, we tend to look at the LDL cholesterol level because it is the one which is most closely related to develop atherosclerosis or cardiovascular diseases. So in a normal person without any medical condition, if the LDL cholesterol level is less than 100, it is considered optimal. But when the LDL cholesterol increases gradually, the risk of developing cardiovascular conditions or atherosclerosis rise exponentially. Similarly, there are optimal values recommended for total cholesterol and HDL cholesterol as well. Talking about a lipid profile is incomplete if we don't talk about triglycerides. What is triglyceride? Triglyceride is also a type of a fat, and the significance is when the triglyceride level goes up more than 500 milligrams per deciliter, there's a risk of developing pancreatitis, where the pancreas becomes inflamed and swollen, and you can become very ill. So, and also, if the triglyceride is elevated along with elevated LDL cholesterol, there's a risk of developing heart attacks and strokes. So, what can cause the triglycerides to go up? Most of the time, lifestyle factors are the commonest cause for elevated triglyceride levels. For example, unhealthy food with high fat and high starchy content, and increased weight, increased BMI, or physical inactivity, and alcohol. Apart from that, genetic conditions, certain medical conditions, and medications can also increase the triglyceride level. Okay, so I hope you were able to get an idea about your cholesterol and your cholesterol report in this video, and we'll talk about how we can reduce your cholesterol in the next video. Thank you.